Black people trust science. They just don't trust how science has treated us.
Professionals working with Black, Indigenous, and people of color say racism in Canada's healthcare system has caused mistrust for many in the community. They want the issue addressed in order to encourage everyone in racialized communities to get the COVID-19 vaccine.
More recently, as the vaccine is being rolled out, against a history of science treating us poorly, has been enormous skepticism.
June Francis is the director of SFU's Institute for Diaspora Research and Engagement and co-chair of the Hogan's Alley Society. She explains the skepticism around receiving the COVID-19 vaccine in Black communities stems from a dark history of racism.
We also know that we continue to experience poor treatment at the hands of both science, who don't test to ensure that we're going to benefit, who don't pay attention to the diseases that we have, and also when we go to hospitals and in terms of the service delivery, we also know that we experience poor treatment.
Ottawa-based physician Dr. Quadro Carmanteg says he's also heard about a hesitancy to receive COVID-19 vaccines in BIPOC communities.
I personally have gotten the vaccine, and I took a picture of myself getting the vaccine to address that issue, to address the hesitancy. And so to be proactive about it, like go into the communities, ask them what their issues are, what their concerns are.
But Dr. Farah Sheroff, who is a public health researcher and educator at UBC, explains it's important to not conflate the concept of vaccine hesitancy with the desire to be safe from racism.
The vaccine hesitancy often has a tinge of anti-science or religiosity. I would say that people who understand racism in the medical system are just taking measures to protect themselves and their families.
So in order for public health authorities to regain trust, Francis is calling for a number of changes.
I'm calling on them to urgently collect race-based data. I'm calling on the province to work with us to spread the word on a campaign to ensure that our community has the reassurance and access and service that gives them the comfort that they should feel to in fact take this vaccine.
In an email, the BC Human Rights Commissioner agreed that BC should provide race-based COVID-19 data that's used in a way that furthers the health and human rights goals for which it was collected. According to the province of BC, race-based data on COVID-19 cases has not been systematically collected, with the exception of First Nations data.
The lack of transparency has only exacerbated the reluctance to have any confidence in the public health measures.
In Burnaby, Miranda Fatour, City News.